Are you over 40 and tired of living with knee pain and considering a meniscal surgery? Think again. As we age, our knees naturally degenerate, leading to meniscal tears and pain. But what if you could avoid surgery and fix your knee naturally? In this video, we're going to show you key exercises for your knees to alleviate pain without going underneath the knife. Watch until the end so you can learn how to take control of your knee health and regain your mobility and confidence, whether you're in your 40s, 50s, or 60s. It's never too late to start taking care of your knees. So why wait? Start your journey to a pain-free life today. First, let's talk about the statistics on meniscal surgeries as we age, and when it's successful and when it's not successful, and what is really your true problem. I know because this happened to me and many of our clients who have come through our office. So let's talk about that first. As we age, especially when we get beyond 40, meniscal surgeries rarely work. And there's so many things that you can do, and there's things that can mimic a meniscal tear. I know I've talked about this time and time again, but when you do get surgery and you're over 40, this is a common thing that we see all the time in our office. You had an injury, they went in, they said, yes, we think you have a meniscal tear. The MRI shows that you have a meniscal tear. They go and they have the surgery. They come out, the surgery wasn't as successful. Their pain kind of comes back, but they're able to kind of deal with it. But they're told, yeah, you're bone on bone. And they did this to me in my late 20s. So they're doing this to people that are in their 40s and 50s and 60s. And I'm here to tell you, if you get an MRI on your knee and you have no pain whatsoever, you're going to show a meniscal tear as you get older. It's just what it is. But what are some of the things that can create or mimic a meniscal tear? So one of the first things is you lose your range of motion. You'll do something and you've lost, like you either can't bend it all the way or you can't extend it all the way, or you're feeling stiff. Like if you've been sitting for a while and you get up and it's like you feel really stiff. These are common things with a meniscal tear. The other one is you happen to step and your knee feels like it wants to give away. Very common with the meniscal tear, but also very common if you have some degenerative changes that happens inside that knee. Or one of the other things that we talk about are these fat pads. There's fat pads that are in the front of the knee. They're here. So when you straighten it, you can feel them. It's just kind of like two fatty knobs. Those things can kind of get dislodged in the knee. If you happen to have a forceful bend, or you're constantly bending your legs, or you stepped off the curb wrong, or whatever the case may be, kneeling on your knees is another common way that we see these happen. They kind of get stuck and you lose that range of motion, that knee gets stiff, and that knee can give away. Now, it's not one that gives away all the time. Some people may have a loss of range of motion. Some people may have their knee kind of given away with a loss of range of motion. Some may just feel a little bit of stiffness, like it just feels stiff when I bend it all the way. These are all things that are common that can be helped, and we're going to be talking about those things. So if you get an MRI and this is what happens, man, get to someone that understands the body better. Go to do some of these exercises that I'm about to show you before going and getting your knee cut, because it's very rare that we send people to surgery with a meniscal tear when they're over 40, because it's just rare. Usually it's one of these other things that are causing it. And the more you mess with your knee, the more you will have arthritic changes, the more problems that you have in your knee. We can still, again, take care of a lot of those things, but you want to take care of this in a more natural way. So our first thing is, if you're the person you have a loss of range of motion, then this is the first exercise that we want to do. So if you're noticing that, I can't bend my knee all the way, or if when I bend it, it feels tight, or it kind of hurts, or I can't extend it all the way, not like the other knee. I notice that there's a difference there. Or if you feel stiff, like you've been sitting for a while and then you straighten up, it's like stiff in that joint. This is the exercise that we want you to do first, because we need to take care of the mobility first before we can get into some of that stability. So this exercise, it's going to look like we're doing strengthening, but we're actually unloading the joint by not putting weight through the joint, and we're kind of doing an active mobilization. So what you're going to do is you're going to lift up and hold that for 5 seconds. And you're just trying to mobilize that joint a little bit in an active way holding it as tight as you can go, as straight as you can go for about 5-10 seconds, and doing it about 10 times. And what you can do is you can do this exercise and you can look at your range of motion before. So sometimes you can one leg can be picked up at the heel and the other one, like, it just doesn't do that. So you can use that as like a baseline. You can use the bending as a baseline, so you can kind of see how far can I get all the way up. I was here and now I'm getting back here. Then you know this is working, and that's what we're looking at doing. So again, you've got to improve that mobility first before going into that stability. So this is the first exercise. Some of the stuff when you have degenerative changes too, so you can get like particles that kind of break off and you're flushing them out of the joint. That's kind of the other way that we describe it. But a lot of times these fat pads are in the knee specifically are the reason why that you will have some of these issues. So you'll have tenderness over those fat pads is a good sign. That tenderness can go away just like that, like instantly. That can be another baseline that you can kind of use. And so doing this, and if this is helping you, we want you to do this 3-4 times out throughout the day. In this way where you have a bolster kicking the leg up, it works best this way. Don't do them this way, sitting here and doing it. If this doesn't work as well, you need the bolster, you need that knee kind of bent over. It just works better for whatever reason. That's what we found in our office. So doing that exercise, holding it 10 seconds, doing it 10 times, and doing it 3 to 4 times a day. So if that's helping with your knee range of motion, keep that exercise up. Keep on going until you feel like it's continuing to improve. And if it doesn't fully get there, there can be other steps that we take, but that's for another video, another day, and another time. So what are some exercises that we can do to start strengthening the muscles? Because a lot of times it's these quads just get overworked, and what we really need to do is work on getting those glutes to fire. So the next 4 exercises will be focusing on our glutes. We're going to do them in a standing position because we need to get these muscles activating in a standing position because that's what we do all the time. That's usually when our knee hurts. So that's why we're doing them this way. So the first one is just standing and just going in and squeezing the glutes. Just a standing glute squeeze, holding it, then coming back. If you're doing this exercise and you're feeling it in the knees, then we need to modify it. Maybe we need to do this on the table. But if you can tolerate doing this in standing and you're feeling like, yes, I feel it in the glutes, my knees feel okay when I do this, then this is a great starting place for you to do. So when you do this, I would say holding it again 5 seconds or so, doing it about 10-15 times and starting there. The big thing with all these progressions that we're about to give you is you want to feel it back here. You don't want to feel it down here. If you're feeling it down here, it's too hard of an exercise. You're not doing it right. You're compensating in some way. Stop doing it. Go back to an exercise that did work. Do that a few more times before you kind of progress to these exercises. But I'm going to show you 3 more besides this one of a strengthening exercise. So that's the first one that you're going to do. And again, I want you to do it 10 times, 10-15 times, holding it about 5 seconds. So the next exercise that we're going to do is we're going to place our feet, we're going to turn them out about 45 degrees, and we're going to bend the knees just a little bit. You're just going to hold that position. So if you have knee pain with this, we need to stop. You can bring your feet a little bit farther apart. Sometimes that will take some of the knee pain away. And what you're going to do is you're going to do the same kind of thing. You're going to squeeze the glute and almost like push your pelvis forward so that we get these glutes to fire. We're going to, again, hold it about 5 seconds and then relax. Keep the knees slightly bent. The feet are turned out at a 45-degree angle. And then, again, squeeze the glute and push the pelvis moving forward in this direction, holding it, again, about 5 seconds. We should feel this in the back of the legs. We shouldn't feel it in the knees. Again, you can bring your feet a little bit wider. That's going to help with if your knees feel a little bit have some pain with that slight knee bend. Just bring your feet a little bit wider. If you can bring them closer in, that's totally fine too. And you'll squeeze the glute and push that pelvis forward to really get those glutes squeezed. Again, doing these about 10-15 times, do them a couple times a day, holding them for about 5 seconds. The next one we're going to do actually is a movement one. And you can get up against a wall to kind of hold up. Your foot, again, if my leg is the foot, you want it to turn it out, again, about a 45-degree angle. So it's not forward, it's kind of moved out to a 45-degree angle. And then we're gonna raise it in a 45-degree angle. So we're not gonna raise it out to the side, we're not gonna raise it straight back, we're gonna raise it at that 45-degree angle. So you hold here for balance, squeeze the glute as you lift it up at a 45-degree angle with your foot turned to the outside. And again, lifting up, hold. You should, again, feel this in the hip that you're standing, that is moving. So again, doing that about 10, 15 times, a couple times a day, will work that out nicely. Well, the last one we're gonna do is up against the wall. And we're gonna put, so the leg that is up against the wall, this is the leg that's going to work. So it's kind of like a leg press, a reverse leg press, but you are doing it up against the wall. So you'll come in and you wanna push with the heel. You push with the heel, squeeze the glute to come out. And then you'll go back in, push to the heel. It's like you're pushing the wall away as you do this to get those glutes to kind of fire. So every time, push through that heel, squeeze the glute to come forward. And again, doing these 10, 15 times, a couple times a day to really start building up the glute strength so that we can take the pressure off the quads. If we at all feel any of these exercises in our quads, in our knees, you're not doing it right, you're compensating, or it's too hard for you and you need to modify what you do. And so make sure you just go back to maybe the first exercise, the standing glute squeezes, or go onto the table and just start with the glute squeezes so that we can start working on getting the strength back in those hips. Again, if you like what we do, like this video, share this with someone that needs to hear this message. We're just trying to get information out to people so they can avoid surgery, not be on medications, get their life back without doing all these different types of procedures and going down this path of like, oh my God, I've done one surgery, now I have to do another surgery, and now I'm going to be on drugs for the rest of my life. And just go in this tailspin, and it's possible to heal our body if we give it the right environment without having to do all these procedures and surgeries out there. Subscribe to our channel so that you can get our videos. We put out content all the time. So we will see you next time.